6:15 right now. It's well known that October is Breast Cancer Awareness Month. It's the time of year to spread the word about this deadly disease. Dr. Kevin Campbell here with us this morning with more. Doc, good to see you.
Good to see you.
An important topic. First, for folks at home who may not know, what exactly is breast cancer and how many people does it affect?
So breast cancer is an enormous problem in the U.S. today. About 250,000 women will be diagnosed with breast cancer this year. 40,000 will die of breast cancer this year. It's a disease where you have a cancerous growth in the tissue of the breast. It can be the breast tissue, it can be the tubules, the ducts, and it depends on what type of cancer in the breast it is, how we treat it.
Right, and there's some recent research that was done that shows that a way to treat it, something you can do besides going to see your doctor and medicine, is exercise. Expand upon that.
A great study came out, and it was over 20 years. It was a survey of women in a large database, 75,000 women, and they looked at what they could do to prevent breast cancer.
Right.
Out of the 75,000, about 5,000 did develop cancer. What they found is those that exercised, even lightly, like walking 3 or 4 times a week, 15% reduction in cancer. Those that vigorously exercised, really broke a sweat, 25% reduction in cancer rates, which is huge.
Yeah, absolutely. What's the reason for the association? I mean, we all know we should exercise, but specifically when it comes to cancer, what's the association?
Prior to this, a study out of the University of Minnesota looking at about 300 patients looked at why exercise seems to affect breast cancer. What we found was that in these patients, estrogens, which are associated with breast cancer, are metabolized or broken down in different ways if you exercise. And this seems to create a less warm environment for cancer to grow. In addition, lean muscle mass, less body fat that you get with exercise also helps prevent cancer.
My mother-in-law, breast cancer survivor, she swears by a fantastic diet, and she is very strict. What about a diet for folks at home?
I think that always eating healthy, making sure that you avoid high-fat, fatty foods is also very, very important. I think that there is some research out there on certain diets that are very good to help cancer survivors as well become healthy again.
Yeah, good to know. Dr. Kevin Campbell, always
Great
good to see you.
Thank you
sir.
so much.
And of course, if you have a medical question for Dr. Kevin Campbell, really easy to ask him. Log on to our website, WNCN.com. From there, you can find his website, his Facebook page, and also you can ask him questions on Twitter. He does respond, Paige.
Yes, he does. Very active.